So next I will demonstrate inserting an indwelling catheter. So first you're going to review the physician's order and the patient's chart, and you'll see that the doctor has ordered this patient to have an indwelling catheter. So you will gather your necessary supplies, go into the room, you're going to introduce yourself to the patient, check their armband and for their two identifiers, so get them to verify their name and date of birth. Then after that, you will ask if they have any allergies and just let them know that you are going to be doing the indwelling catheter on them, that they are going to feel a little discomfort and pressure, but if they ask if they have any concerns, or just let them know that if at any point they need you to slow down, that just to voice that to you. Next, you will perform hand hygiene, and then you will don your gloves. So after you don your gloves, you will just either adjust the patient's bed so that it's easier to work, so about to your waist level, and the patient should be, covered and have a gown on. She doesn't, but hypothetically she has a gown. So you'll just lower the bedding down about to her feet area, exposing the perineal area. So you'll just lift their gown, and then you will get your catheter kit ready. So you'll also assist the patient to have their legs either spread or flexed if they can. So if the patient can open their legs, you can usually either set up the catheter kit on top of the patient's lap or in between their legs, but you just have to judge based on the size of the patient. So now we'll have our catheter kit, and usually you would have it, I'm just gonna put it on top of the patient for now, just for the purpose of the video, to get everything fit in. So you're gonna open your catheter kit, and you're just going to use this bag as your disposal trash bag. So we'll just put this at the foot of the bed, and then you will open the catheter kit. So you'll open the distal side first, and then the two flaps here, and then the proximal side closest to you. And then in your kit, move this down a bit, you will have sterile gloves, you'll have your two covers for the patient. So this one you would put about on the patient's lap, a little lower, and then you would have the one with the opening, you would open over the patient, and you would make sure that the opening, either for a male, the opening goes around his penis, or for a female, you would put it and have the opening open over her vagina. So we'll just have these placed down on the patient. And then next, I would don my gloves, and I would begin to set up the sterile field. So now that you have that set up on the patient's lap, you can take this part, the top part of your kit out as well, put that in between the patient's legs, and you can squeeze your lubricant onto your tray, discard that in your trash bag, and then you'll either have some kind of sterile swabs or the Benadine solution to pour over cotton balls, and then you would just discard any trash into your receptacle at the end of the bed. So you have your lube in the tray, and then you have your swabs. So then next you want to provide perineal care. So actually, I'm sorry, before you set this up, you would provide perineal care. And then you would take your gloves off, hand hygiene, and then set up your sterile field. So now that you have everything set up and you've provided perineal care, the patient is ready to go. So we're just going to take out the indwelling catheter, and you can have this part still in your kit. And then before you would do this, you would don your sterile gloves, since this is a sterile procedure. And then you're going to set this, you can set this right here, to prepare that to put in the lube. And you will take this, attach that. Alright, so this is attached. And then now you will spread the labia for a female, or grab the head of the penis with your non-dominant hand, and then you would take your sterile swabs or your cotton balls and get ready and clean with that sterile solution or the Benadine solution. So for a female, you would do the outer lip first, then the one closest to you, and then go in the middle. And usually you would have different swabs or multiple cotton balls. So for each one, you would use it, throw, use it, throw, use it, throw. And then now you should have your catheter, the head of the catheter, lubricated, and then you will begin to insert the catheter at a 90-degree angle and slowly keep pushing until you hit eureka, and urine will start to flow. So then after that, you just push it a little bit further, usually about 2 inches further, and then you are going to inflate the balloon. So you'll just push that in, discard that, and then you will just slowly pull until you'll feel it kind of get stuck. So after that, now that you have your catheter in, you want to doff those gloves, since that has touched the vagina or penis area. You're just going to clean up the patient. You can rip the paper off of the patient and just fold those up, discard that, and then now that you have everything cleaned up, you will make sure that you want to tape the catheter to the inner part of the patient's thigh so that it'll stay. And then when hanging the bag, you want to make sure that it is below the patient's bladder, so you don't want it to ever hang above. So you want to just either hook it to like the side of the bed, a little lower. So now you have that hung, you have the catheter in, and you have all of your supplies cleaned up. And then you would just make sure the patient's comfortable, put back up their bed rail, lower their bed to regular position. You would perform hand hygiene and put the call bell as well by the patient too. Just let them know they can call you if they need anything. And then you would perform hand hygiene and document and chart what you just did.